You can go ahead and introduce yourself.
My name is Adam Ellis. I'm a physical therapist. I graduated from the University of Buffalo 2010 with my DPT. Practiced in outpatient orthopedics since 4 years at a local sports-based hospital setting, and now in a private outpatient ortho setting.
Have you ever had contact with someone who was using opioids, and what was your experience with them?
The answer is yes, in multiple different settings. So I think it really, where you're encountering them plays a big on your interactions with them. So if you are, I've worked with folks who are on opioids in a post-operative setting in a hospital where I had to get them 2 hours after coming back from a hip replacement. Those people need opioids in order to function so that they could go to the bathroom, or so they could perform a transfer in bed to avoid pressure sores. The folks who have been on opioids for 10 years after a spinal fusion are still in 10 out of 10 pain and aren't working or participating in a healthy, active lifestyle. Those are the folks that we need to spend more time on. The person in the hospital on opioids so that they can the bathroom, the people we need to spend time on. That's what an opioid is for.
How do you think it would be better to promote using physical therapy over opioids?
I think identifying the patients and populations more so than patients that would benefit the most from a movement-based assessment and intervention. As physical therapists, we are not folks who are specialists in medications. We are specialists in movement. So I think the best way to identify is figure out if movement is a barrier for them or if pain is limiting their ability to perform movements. And then our job should eventually figure out a way to help them move easier, or also to educate them that necessarily the amount of pain they're in does not mean in that much something will be damaged if they move. So I think there's a disconnect between what they feel and what they think is going to happen because of the pain. Spend so much time with them in whatever setting we're in. I think our role should be as education and breaking down those barriers of that pain equals damage.